Good afternoon, and welcome to the City Club of Cleveland, the oldest continuous free speech forum in the country. My name is Jan Roller, and I am president of the club. Our country recently went through a protracted, heated battle on health care reform. President Obama signed his landmark health care overhaul, the Patient Protection and Affordable Care Act, into law last month on March 23rd. Today's guest, Dr. Valerie Arkoosh, is our first forum speaker to discuss the reform efforts and package since the law was enacted. And she knows what she's talking about. She practices medicine and is a professor of clinical anesthesiology and critical care and obstetrics and gynecology at the University of Pennsylvania Medical School. In addition to her medical degree, she holds a Master's of Public Health from the Johns Hopkins Bloomberg School of Public Health. Her policy study focused on the ways to provide access to health care for uninsured Americans, with a particular emphasis on the impact of comprehensive state-based health care reform efforts. Dr. Arkoosh was literally the face of health care reform. When Health Care for America Now, the nation's largest health care campaign, aired a television ad emphasizing the need for a public health insurance option, Dr. Arkoosh was featured in the ad explaining that private health insurance companies have been in control of decision-making for too long. She was also named to the list of prominent healthcare experts and economists by the Institute for America's Future to provide information, analysis, and interviews during the healthcare reform debate. Even though the healthcare reform bill is now law, Dr. Arkoosh continues her busy pace as president of the National Physicians Alliance, an organization of 20,000 physicians across specialties and throughout the United States. It seeks to mobilize physicians for a just, equitable, caring, and effective health care system. Ladies and gentlemen, please welcome to the podium Dr. Valerie Arkoosh.
Thank you, Jan, for that wonderful introduction. And I'm so pleased to be here today at a place that is all about having civic dialogue and civic engagement. The National Physicians Alliance was founded as a home for physicians who believe that it's important to be civically engaged. So it's just wonderful for me to have the opportunity to be here today. And I also want to thank Dr. Arthur Lavin and Doctors for Healthcare Solutions, as well as Rachel DeGolia, who's back there, from Universal Healthcare Action Network, who helped to sponsor my being here today. Well, I'm going to start for a moment by framing this incredible vote and effort that has kind of consumed this country, actually, for the last year and a half or so. And when we look at our healthcare our healthcare system from a patient perspective, our patients find that our system's kind of sick. We know that there are about 47 million Americans in this country right now who lack health insurance, and that it's about 15% of our population. And 81% of those folks are in working families. So they're doing everything right, but they just can't seem to get health insurance. Simultaneously, employer-sponsored health insurance rates have been falling. That's where most people who are under 65 get their health insurances in this country, is from their employer. And those rates are down. They were down to 59% in 2009, I think partly as the impact of our economy. And underinsurance is a huge barrier to care for a lot of people. Many people believe that they actually have a health insurance policy that will cover them if they're ill, and then they get a serious illness and they find out that many of the treatments that they need are not covered. And that's contributing to a significant number of bankruptcies in this country. Now, from society's standpoint, we spend a lot of money on health care in this country. In 2009, we spent $2.5 trillion on health care in the United States. And to put that into context, the law that was just signed by President Obama costs $948 billion, and that's over 10 years. So in just 1 year, last year, we spent $2.5 trillion. So even though that bill sounds like it's a pretty big number, in the context of what we spend on an annual basis, it's really not that much. So if we break down that $2.5 trillion number, we spent per person in this country $8,047 in 2009 on health care. $8,047. And that puts us way, 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 way ahead of any other country in the world in terms of per capita spending on health care. And that might be okay if we got a really good return on that investment. But when you look at a number of measures of health care in this country, we actually do pretty badly in World Health Organization rankings. We're down in like the 30s for things like infant mortality, longevity of our population, just basic measures of public health. So we're not really getting a lot of obviously fantastic outcomes for that huge per capita spending that we have. So with that context, I wanted to give you that context as we move into this debate, and part of why this debate was so acrimonious. Now, healthcare costs have been increasing about 6% per year in this country, and a lot of people did a lot of extrapolation during this last year about what would happen if we did nothing. Let's just say we didn't pass this bill and we just let the status quo persist. And what that would mean for individuals in this country was pretty staggering. Right now, the average family pays about $12,000, $12,500 for a family health insurance policy. If nothing changed, the estimate is that in 2020, the average family would pay $23,800 for that same health insurance policy. And because of the cost of that, the amount of uncompensated care would increase even more, such that it would double in 45 states by 2020. So that is part of why there was such passion and energy around getting something done this year. And in fact, I think the one bipartisan agreement, the one place where there was bipartisan agreement was that something needed to be done about our healthcare system. However, what those solutions were very, very different depending upon who you spoke to. And as you've heard over the last year and a half, there caused a great deal of argument from the two sides about what the best solutions were. And those solutions come down to really a very simple philosophical belief. If you ask the question of the citizens of this country, is health care a right or a privilege? It turns out that we're pretty equally split as a country on the answer to that question. About half the people believe that it is a fundamental right and that our society has an obligation to make sure that the members of our community have access to quality, affordable health care. And about half of us believe that, really we're kind of on our own when it comes to health care. And it's up to each of us individually to find our own way, that there's not a big role for federal government in this, that it should be left to the marketplace, and that people should be able to sort this out on our own. And so that very fundamental divide, I often call it the cliff notes of the whole health care reform debate, was the underpinnings of much of the very impassioned argument that went on in this country, some of it argument, some of it dialogue, during the last year. So you saw it play out in the presidential election. Senator McCain and Senator Obama had two very different approaches to solving the problem, reflective of that split that I just described to you. Obviously, President Obama was elected, and he began a process, and the process started like this. He articulated a set of principles, there were 7 of them, and he enumerated them about 10 days after he was sworn into office, and he said to Congress, I want you to write this bill. But here are the things that I care about, but I want you to write this bill. Now, this was very different than the approach that President Clinton had taken back in the 90s. President Clinton got a bunch of, small number actually, of stakeholders together, about 100 people, and wrote a bill and delivered this bill to Congress. And Congress said, whoa, this is too much for us, this is too controversial, we don't really understand it, we didn't help write it. And for a whole host of reasons, pretty soon that bill was dead. So President Obama took a very different approach. He said, here are the things that I care about, but you guys write it. Understanding that if Congress wrote it, they would be personally invested in it, and it would be much more likely to actually make its way through the legislative process. The other advantage that President Obama gave to this effort by having Congress write the bill was that gave all the thousands of stakeholders out there who are involved in healthcare in this country, to some extent, a seat at the table.